The government is mulling to further relax SOPs once the administration of booster doses is completed. Public health specialist Dr. Muhammad Farhan Rusli says that Malaysians would be subject to less testing and shortened quarantine as we move into the endemic phase.
So 3,000 cases a day, 3,000 per day is reported number of cases. But there will be a large chunk of people who will have been exposed, who would actually be carrying the virus, who are not tested. Now, the reason why the situation now and last year is different is because a lot of people who are not tested are actually people who are actually fully vaccinated. So they perhaps do not show any symptoms and they are not showing any signs of any cough and cold or fever and all this. That's why they don't get themselves vaccinated. And this is something which we have to get ourselves used to, because this is also moving towards the next step of endemicity, where you only get yourself tested if you actually have any symptoms.
Dr. Farhan said it is probably time for us to move away from reporting daily COVID-19 cases.
We should be looking at the number of cases that's being hospitalized, number of ICU cases, and number of deaths, because this is a clearer indication of how severe cases are actually in the country. Because like I said before, you can give me 50,000 cases. If they are all mild and asymptomatic, I'm not as worried as if the number of cases in hospitals actually shoot up. The number of ventilators that's being needed is actually shoot up. So this is where the message to the public needs to be much more clearer, and you need to actually table it to the public. What are the numbers that we're actually seeing?
Despite all this, Dr. Farhan said that mask and physical distancing are here to stay during the endemic phase. Besides that, quarantine may also be waived for COVID-19 close contacts.
Perhaps close contacts will no longer need to be quarantined unless they are symptomatic, no longer needed to be tested unless they are symptomatic. So now you're going to just be moving along, and to reduce the disruption for people. Because as you know, if you talk about 3,000 people being positive COVID cases, that is not a burden on the national system. But the 3,000 people will probably have 30,000 or 90,000 close contact. So the 90,000 being needed to quarantine, now that is the difficult thing, right? Because then you have disruptions in the workplace, you have disruptions on the factory floor and all these things. So when you move towards endemicity, now you have to put your faith and your trust into the vaccines that you have always advocated, saying that vaccines are the way out. So vaccines are the way into endemicity, and endemicity is the way of us living with COVID.